Edema is a condition characterized by the buildup of excess fluid in body tissues, resulting in swelling and discomfort. It can affect various parts of the body, leading to a range of symptoms and complications if left untreated. In this discussion, we will delve into the causes, symptoms, treatment options, and potential complications of edema, taking a closer look at different types of edema and their impact on primarily the lower extremity. Edema occurs when an excessive amount of fluid accumulates in the interstitial spaces, which are the spaces between cells in body tissues. This fluid buildup may be caused by several factors, including 1. Increased capillary pressure. Conditions like heart failure, kidney disease, and pregnancy may lead to fluid retention due to increased pressure on the blood vessels, disrupting the balance between fluid intake and removal from tissues. 2. Reduced osmotic pressure, which is a decrease in proteins like albumin in the blood, often due to liver or kidney disease, lowers osmotic pressure, causing fluid to remain in tissues. 3. Lymphatic dysfunction. When the lymphatic system fails to effectively drain excess fluid, as seen in diseases such as lymphedema, fluid collects and causes swelling. 4. Inflammation. Inflammatory responses triggered by trauma, infection, or chronic conditions like rheumatoid arthritis can lead to localized edema. The most common form of edema, known as peripheral edema, affects the legs, ankles, and feet. It can occur in one foot or both feet. Causes of swelling occurring in both feet are venous insufficiency, probably the most common cause, where the valves that pump blood back up to the heart become incompetent over time, so the blood attempts to travel back up to the heart, but falls back down and settles in the foot and ankles. By the end of the day, the feet and ankles will be swollen, but upon arising in the morning, there is usually minimal to no edema. Another factor is excessive humidity. This too will be worse at the end of the day and much improved first thing in the morning. Standing too long, without much movement, or sitting too long where there is too much pressure on the veins in the back of the thigh will also cause peripheral edema. This is more common in the elderly. Other causes of peripheral edema include congestive heart failure, lung disease, kidney disease, thyroid disease, pregnancy, people with salt sensitivity medications including vasodilators which act to open up arteries, which bring more blood down to the extremities, calcium channel blockers which are used for high blood pressure, estrogens and NSAIDs such as Aleve, Motrin or Advil along with the prescription versions all may cause excess water retention. This is particularly true in older individuals, and that is why they should be avoided in prolonged doses in those populations. Causes of swelling in only one foot and leg: trauma to the foot or ankle. Arthritic flare-up of a joint, which will usually mean a localized swelling in the foot or ankle. Deep venous thrombosis, DVT, which most likely is occurring in the calf. This is potentially the most dangerous cause of unilateral swelling and needs immediate medical attention. Gout, which is classified as an arthritic flare-up, will cause localized swelling. Infection in the foot may also cause localized swelling. Foot and ankle surgery will also cause swelling. After surgery, it is normal for the foot to swell as the body is increasing the blood flow to the surgical site in an effort to facilitate healing. Lymphedema, which is an abnormal removal of interstitial fluid between cells, through a problem with the lymphatic system. This is usually due to an obstruction of a lymph node. Can also occur in both feet. Treatment options and advancements. 1. Lifestyle changes. Managing edema often includes maintaining a low-sodium diet, staying physically active, and elevating the affected limbs regularly to promote fluid drainage. 2. Diuretics. Medications like diuretics may be prescribed to promote increased urine production, reducing fluid buildup in tissues. 3. Compression therapy. Wearing compression garments or bandages can help prevent or manage edema by applying pressure to the affected area, promoting fluid drainage. 4. Lymphatic drainage. Techniques such as manual lymphatic drainage or specialized massages may be recommended to stimulate lymph flow and reduce lymphedema. Potential complications and the importance of seeking treatment. If left untreated, edema can lead to accompanying complications such as pain, limited mobility, increased risk of infections, and skin ulcers. It is vital to consult a healthcare professional to identify the underlying cause and begin appropriate treatment promptly. Conclusion. Edema can affect different parts of the body, causing discomfort and potential complications. Knowing the causes, symptoms, and treatment options can empower individuals dealing with edema to proactively manage their condition. By seeking medical advice, adopting healthy lifestyle changes, and utilizing innovative treatment methods, individuals can find relief and regain control over their lives.